Have you ever asked yourself, what is mental health? It is not about being happy all the time or the absence of illness. Mental health is being able to feel, think, and act in ways that help us enjoy life and cope with the challenges we face. As our life experiences and circumstances change, so can our moods, thoughts, and sense of well-being. Many things can affect our mental health in a positive or negative way. Stressful life situations, adjusting to life in a new country, living through violence, trauma, loss, discrimination, and racism are some things that can negatively affect our mental health. So, what is the difference between mental health and mental illness? Well, mental illness is a medical diagnosis given by a doctor, just like other illness like diabetes. And like diabetes, medications, supports, and treatments such as counseling can help someone get better. Mental illness can affect people of all ages, gender, education, income levels, and cultures. However, due to myths and misunderstandings, some people believe that mental illness is a personal weakness, a curse, or punishment from God, or is caused by the devil or evil spirits. This can result in labeling the person, especially when they are perceived as different or described as crazy or psycho. Because of these negative beliefs and myths, people with mental illness are treated poorly and face stigma. So, what is stigma? Stigma is a set of negative beliefs, attitudes, and behaviors towards a group of people. Stigma exists in every community, and in some communities, stigma can be so hurtful that it affects work, education, family, marriage, and other prospects for the person living with a mental illness and their family. Stigma can also stop people from being accepted by their family, friends, community, and it can stop them from getting the help they need. When people living with a mental illness are supported and get the help they need, they can have good mental health. Let us look at an example. This is May. May's family moved to Canada when she was 10 years old. Lately, she feels sad and does not feel happy doing the things she used to enjoy. She feels stressed because her parents and teachers expect a lot from her. She struggles living with one culture at home and another one at school and work. She does not think her family will understand what she's going through. Luckily, May is close to her Aunt Hung, who notices these changes and asks her how she's doing. She feels relieved that she can talk to someone. Hung listens to her, and together they write down things May can do to feel better, like remembering what helped her in the past, thinking of things she is grateful for, writing down her feelings before she talks to her parents, and speaking to a counselor at school. Like May, we all have days when we do not feel our best. If you continue not to feel well, it's important to speak with a health professional, just like you would if you don't feel well physically. Taking care of your mental health is just as important as taking care of your physical health. Write down one thing you can do to stay mentally healthy, like remembering what helped you deal with stress in the past, making time for yourself, praying, or reflecting on what you are thankful for, reaching out for help from family, friends, community leaders, or health professionals, getting help early. For more information on mental health for newcomers and diverse communities, check out settlement.org and multiculturalmentalhealth.ca. For more information and resources on mental health and mental illnesses and when and where to get help, visit havethattalk.ca to learn more. Brought to you by Ottawa Public Health.